Hey y'all, I want to stop by to remind you that even as a CT tech, you have to know if an order is correct or not. So if a doctor or provider orders a scan, we should know or have an idea if the scan will be sufficient enough, will give them what they're looking for. Let's say they come in for trauma and a doctor orders a CT head with contrast, and they might have done it mistakenly. Maybe they were in a rush or they just, clicked something wrong. But it's our job to know that a CT head with contrast would be something that would be a wrong order for that patient. Remember to always be an advocate for your patient because we want them to have the right diagnosis. So why is that wrong? That is wrong because on a CT head, a bleed can also get confused with a contrast because a bleed is white and contrast shows up white on CT scans. So I just wanted to remind you guys to just be aware of that. Don't be afraid to just clarify things. All you have to say is, hey, I just wanted to clarify. The patient came in for a CT or a head trauma. Do you still want this with contrast? And if they insist, kind of explain to them that it won't catch a bleed if we give contrast first. So another thing that I wanted to share was CT. Well, let's just stop it at that. And then I'll continue more later. So as of right now, I want to remind you guys that it's okay to talk to your physicians, talk to your doctors, talk to anyone that's ordering that. Don't be afraid to do the right thing. Because a non-contrast head is normally the first thing you want to do to see if there's any fractures. And that can be seen with contrast, but you want to see if there's fractures, or the main thing is a bleed. A bleed is very crucial to the patient, and we want to see that without contrast. So just remember that if you're suspicious or the doctor's suspicious of a bleed, no contrast, because contrast can look like a bleed and we don't want to get that confused. All right, so be safe, do the right thing, advocate, and don't be afraid. It's okay. Communicate with your providers, communicate with your team. Communicate is important. Communication is important. So yeah. And even as a patient, if you go in as a patient, let's say you're getting a CT head yourself, it's okay to ask questions. It's okay to ask the doctors what it is, because sometimes they come to the CT scanner not knowing what's going to happen. The doctor orders something and the patients sometimes don't know what's happening. So if you don't know what's happening and you show up in this room with a big scanner, you've never been in there, it's kind of noisy, they're making you lay down, all this stuff. It's okay to ask questions. Inquire. It is your body. It is what they're doing. Unless, of course, you're unconscious and everyone's trying to do the right thing for you. But if you have questions, don't be afraid to ask. Sometimes the techs don't know because we don't get all the information, all your medical history and all that stuff. We don't get paid for that, and we don't go to school for that. Questions are for your doctor, for your physicians. Nurses will know most of the stuff, but at the end of the day, if you have anything to inquire, don't be afraid to ask. So the key point of this video is communicate and don't use contrast for a CT head that is suspicious for a bleed. Okay, doodles, noodles.